guys, I'm back. I'm waiting on AJ. I'm about to go into the Reproductive Health Center here in my town. I'm having my 2-month checkup. I've been on my metformin for my PCOS for about 2 months now, so she wants to just check up and see if the dosage is working properly, how I'm feeling on it, if I need more of the medicine, less of the medicine, stuff like that. I'm assuming. I don't think I'm getting any ultrasounds or anything done today, but I guess we will go find out. So I'm about to head up and wait for AJ and check in and everything, and I will check in with you guys later. Bye.
This is you.
This is you. So this was from the end of August. Now I know your first analysis, you guys had just ejaculated shortly before the analysis. So we were like, oh, okay, maybe that's why it was off. At that point, the motility, which is the percent of sperm that are moving, was actually normal.
Cool.
In April. This time it was low. We had only 19% of the sperm that were moving, and that were moving well, and only 27% that were moving at all. It looks like you had 3 days of abstinence, and you collected it off-site, but you got it here very quickly.
Good job.
You didn't have it in the refrigerator or anything crazy between here and there. Okay. So now we just have a discrepancy between normal motility at one point and low motility at another point. Then we look at when the motility is low, the lab will do something called viability. That's actually a test where they can stain the sperm to see, are the sperm alive and just not moving, or are they actually dead, which means they don't have potential to work. And the viability was low. Only 22% were viable, meaning alive, and we would expect normal to be above 58%. So that's a concern. And then we look at sperm numbers, which were also low. And they were low the first time, but you had just ejaculated. So this time they're actually even lower. So the total sperm number was 6 million. We like to see above 20. We also look at sperm numbers per cc or milliliter of seminal liquid, because the more volume somebody has, the more that sperm number is going to be dispersed throughout that volume. And that you had 22 million per milliliter of fluid. We like to have 39 million or above. No, that was total sperm count, sorry. And then you only had 9% per milliliter. Normal's about 15. So sperm count all around was low, motility was low, viability was low. Then we look at morphology. So that's how the sperm are actually shaped. So underneath the microscope, we know that a sperm should have a head that looks a certain way, an acrosome that looks a certain way, and tail that looks a certain way. And the first analysis, we would expect 4% or normal, 4% or above to be normal. First analysis, only 3% were normal. This time only 1% was normal. So something I think is going on, which is a piece of the puzzle, which is why we test both males and females. I think because you're having trouble with your tonsils, I don't think that has anything to do with it. But I think we need to look a little harder just to see, so that we can make everything optimal with you, so that we can give you your best chances for pregnancy. Now, the bottom line is, you've got enough sperm to achieve a pregnancy, but as of your last analysis, I think it's going to be really tough to achieve a pregnancy without something called in vitro. You guys know at all what in vitro is? So it's a matter of, does it make sense to go ahead and put you on the ovulation meds to try to improve ovulation now and try for pregnancy? The worst is you're not going to get pregnant. And then we have another option. Or do we talk about doing something that's going to be way more successful? The medicine probably is going to give you a 20% chance of pregnancy if we had normal sperm numbers. If we assume that this problem is ongoing, I mean, you're probably well less than 5% if you ovulate. Okay, I just want to be real. Doesn't mean it's not going to happen. We can do in vitro and you have a 60% chance of pregnancy. Infertility is very stressful.
Yeah.
Very, very stressful.
Love you.
Okay.
Thank you.
Tell me what your thoughts are about in vitro, or have you only thought about it for this long?
I've thought about it, but not really like a lot. Like I know I've like looked up stuff on the internet about it, but I haven't really thought that I would have to do it. So I haven't really like in depth, you know.
So what I can do is send you home with some information that talks about the IVF process. The way I look at it is, if I had here's my tool chest of things that I can do to help people have babies. The ovulation induction meds that I talked about, I told you at best we're talking 20% per month. IVF, 60 to 80% success from one time. Way big difference in terms of success rates. Doesn't always work the first month or the second month, and I've got patients that it never did work for. But it is the most successful procedure in the world in terms of success rates. Right now, at least based on the last analysis, I think it's going to be tough without in vitro. Okay.
Okay.
It's a lot to take in.
Hey. Hey. It's okay. We'll figure it out. That's why we're here. Right? Yeah.
I remind patients this is a couple issue. Most of the time we've got a little of this and a little of that. Thank goodness science has allowed us to find ways to help both of you.
I'm hopeful. It's okay.
You have every reason to be hopeful. I would never tell you that if I didn't think this was going to happen. The hardest part of my job is telling people I don't think it's going to happen. But I will do it because it does not help you one bit for me to paint a rosy picture. I think you're going to need some help. I think in vitro is your best option.
Okay.
But we haven't even done a workup to see what's going on.
Could be nothing. Could be just because you're sick. You never know. Gotta be positive. Just keep swimming. Just keep swimming. Just keep swimming.
You guys are such a cute couple.
Thank you. Just keep swimming. Just keep swimming. I'm serious. I love you. Alright, well he's got to get back to work and I'm going to go do some research and yeah, we'll talk to you guys later. Bye guys.
Bye guys.
Thank you for watching. Blue. Thank you.